My name is Job Mwanza. I'm a medical doctor by profession, and I'm a public health specialist, a Chevening Scholar graduate from Cardiff University in the United Kingdom. I also did a Commonwealth Professional Fellowship at the same university through Cardiff. And I have known Judith Ho since 2012 when she came through to Zambia. And at that time, I was in charge at Chongwe District Hospital. And through that meeting in 2012, we have collaborated through Mothers of Africa for the past 8 years now. And the collaboration has been moving from one level to the other. We've seen a lot of support that has come through to Chongwe District Hospital through Mothers of Africa support. Initially, in fact, the very first cesarean section that was done at Chongwe District Hospital was done through the support of Mothers of Africa. We had the visiting obstetrician and anesthetists from the UK, and they were around at that time. So we are really grateful to their support, that the hospital, through their support, and of course, the greatest support is from the government, but we had that partnership from Mothers of Africa that helped to operationalize the surgeries at Chongwe District Hospital. So to that, we are so grateful. With the COVID-19 pandemic that we are experiencing in Zambia and also everywhere in the world, Chongwe Hospital has still benefited through Mothers of Africa. There was a provision of face masks to protect the healthcare workers. As you know, the hospital is a very risky environment concerning this COVID-19. And so Mothers of Africa was on hand to provide the face masks, but also soaps that were being used to ensure that hand hygiene was maintained at the hospital. Later on, we got support through the Welsh Government, that is through the Wales and Africa funding, where there was additional support to protect the health workers as well as the community from the COVID-19. So through that funding, we were able to put enough signage at the hospital, but also did provide some more soaps, as well as introduction of elective surgeries at the hospital. That donation actually from the Welsh Government was very instrumental in that we did engage the traditional leadership in Chongwe, and it's through her leadership that she actually made the donation on behalf of Mothers of Africa to the hospital. And that was key in that there's that strong support from the community leadership, such that now the community were able to understand the importance of putting on a face mask as you go into the hospital, because it's a risk environment. And so that was key to ensure that traditional leadership took that leadership to do that donation. So we are so grateful indeed for the support also from the traditional leadership that we are receiving through Mothers of Africa. When schools were opening, Mothers of Africa were instrumental in responding to the call from government that partners should come on board to help pupils as they go back to school. So Mothers of Africa did provide face masks and the soaps that were instrumental in ensuring that the pupils as they go back to school were safe. And this has been done. And as we speak, pupils have been going to school. There's been no problems. And also the hospital is operating almost normal now, because the staff were built in terms of capacity of how they can protect themselves from COVID-19, but also hand hygiene and many other preventive measures. All these were provided, of course, government has been providing, but also with the support from the partners, specifically the Welsh Government. So in conclusion, really, we would like to give special thanks to the Welsh Government and through the Wales and Africa support, but also to Mothers of Africa for this great collaboration, and looking forward really to continued collaboration as we together fight this pandemic, specifically to protect the people of Chongwe with giving them enough information on the COVID-19, but as well as we look forward to the vaccine. With that, I thank you.